to present today is that association of epicardial fat and visceral fat in coronary artery disease patients. I am PhD student. My name is Vijay Pandhare. I am doing this topic under the guideline Dr. Dipali Vedate. She is the professor in the Department of Biochemistry, DY Patil and Devon University, Mumbai. And the co-guide is James Thomas, who is the professor and head of the Department of Cardiovascular and Thoracic Surgery, deemed University, Navi Mumbai. In the first slide, there is an introduction. In the introduction, I would like to tell you about the location of this visceral fat and epicardial fat. The location of this visceral fat is that it is deeply present in the abdomen. So here you can see that the visceral fat which is present deeply in the abdomen, which cannot be felt. We cannot feel that. Whereas the epicardial fat, it is present in between the pericardium and the myocardium. In between these two, you will find this epicardial fat. And in between, there is a presence of coronary artery. So it seems that there is a close proximity. There is a close connection in between the myocardium, pericardium and the coronary artery. So this epicardial fatty fat, it is having a close connection with the myocardium as well as coronary artery. Why I am saying this? Because we are in the next slide, we are going to come across with the coronary artery, why there is an atherosclerosis, why this epicardial fat is responsible for atherosclerosis, because it plays a very important role when there is an increase in the thickness of the epicardial fat. So in the next slide, you will get to see that. So here you can see that this is the visceral fat. When the thickness of the visceral fat is present, it will distribute all over body. It means it is not present at one place, it is distributed in the different parts of the body. Whereas the epicardial fat, you will find this epicardial fat only in the heart, in the surface of the heart. So when there is an increase in the thickness of the epicardial fat, there will be a distribution or on the surface of the heart only. It won't be distributed to other places. And if the thickness is increased, then there will be an different problems which will occur in the heart, which will cause a CAD. This we will see in the next slide. So here, there are certain instruments which are being used in order to find out, in order to see the thickness of the visceral fat and the epicardial fat. So visceral fat can be identified, can be seen, or can be measured with the help of the autoanalyzer. So there is the presence of fat autoanalyzer. With the help of this, we can able to find out the thickness in percentage. So here it has been given the percentage. The green, it shows that if it is in between 1 to 10 units, it indicates that the visceral fat is in normal condition, and if it exceeds, it indicates that there might be an obesity, and because of this there will be an CAD, that is coronary artery disease. Whereas the epicardial fat, which is being present all on the heart and in between the pericardium and the myocardium, so the normal range for the epicardial fat thickness is nearly 3 to 5 mm. If it crosses 5 mm, if it is between 5 to 7 mm, it indicates that there will be a possibility of CAD, that is coronary artery disease. So how it will take place, that we will see in the next slide. So epicardial fat in atherogenesis, nothing but the coronary disease, that is an atherosclerosis, that is a deposition of the fat. So whenever there is an increase in the thickness of the fat in the abdomen, that is nothing but the visceral fat. That fat will distribute it all around the body. So when there is an excess of the fat, because of this fat which is being stored or which is being collected in the adipocytes, the adipocytes which are present in the heart. So these adipocytes will get filled up with the maximum amount of the fat, because of which there will be an hypertrophy. The hypertrophy, because the hyper itself tell you that there is an enlargement of the adipocyte. When this adipocyte get enlarged, the normal size of the adipocyte is nearly 100 micrometer when in the normal size. But when there is an excess of fat which is being stored, which is being collected in the adipocyte because of the obesity, because of the maximum fat which has been consumed, and there will be an collection of maximum amount of fat in the adipocyte which increases its size. but the oxygen which is to be supplied to the normal cell, that normal adipocyte, will be supplied even for the hypertrophy cell, that is the enlarged adipocyte, but that high oxygen is little lesser, because of which there will be an hypoxia. And if there is an hypoxia, there will be an oxidative stress, and when there is an oxidative stress, there will be a release of certain cytokines, that is IL-6, that is interleukin 6. Then even there is a release of the TNF alpha factor, and again one more pro-inflammatory, that is IL-10. All these inflammatory factors which are being secreted when there is an hypoxia. Because of this secretion, what will happen? There are certain monocytes which are present in the bone marrow. Those are being released in the circulation, and from the circulation they will come in the tissue because of this pro-inflammatory cytokines. And when they will come into the tissue, they will phagocyte the tissue, and they will cause the death of the tissue. At the same death of the fat, they will engulf the fat, and they will cause an foam layer, and because of this foam layer which is being present, it will cause an atherosclerosis. The foam layer which is being formed, which has been formed by the macrophages, it causes the atherosclerosis, nothing but there is a stiffness or the collection of the fat which cannot be removed out. So that is why in case of the epicardial fat, when it is been increased, there is a cause of the atherosclerosis. Whereas the inflammation also will be takes place only because of these macrophages. They will cause an inflammation of the fats, the inflammation of the adipocytes. So my aim is that to present the study was to determine the association of epicardial fat thickness and visceral fat in coronary artery disease patients. Objectives are to determine the visceral fat by autoanalyzer in control and CAD patients, to determine the epicardial fat thickness by echocardiography in control and CAD patients, to compare the visceral fat and epicardial fat thickness in control and CAD patients. Methodology which I have been used in the present study, I have included 67 coronary artery disease patients and 62 controls. All the study participants were examined clinically and anthropometric measurements were recorded. Both the groups underwent an echocardiography test by the same technician by assessment of cardiac profile. Epicardial fat thickness is measured as the echo-free space between the outer wall of the myocardium and the visceral layer of pericardium, and is measured perpendicularly on the free wall of the right ventricle at end systole for 3 cycles. The study was approved by Institutional Ethical Committee. The written consent was obtained from all the study participants. So in the result which you have obtained, that is epicardial fat and visceral fat, when it is been the cardiac, that is CAD patient, and the control, when they are compared.
Sir, you have 2 minutes to conclude, please.
Hello?
Sir, you have 2 minutes to conclude.
Okay. Oh, it is going to finish. Okay. The epicardial fat, which we have obtained, the result which we have obtained, it is more than that of control, and even the visceral fat, we have got the reading more than that of control. So here there is a significant correlation between the epicardial fat and CAD, and the visceral fat and the CAD. Even in the graphical view, we can see that there is a correlation with the, there is a significant relation between the epicardial fat and the CAD and visceral fat and the CAD. So discussion, the epicardial fat is in close proximity to coronary artery, whereas the epicardial fat can be considered as a proxy measure of the visceral fat. Epicardial adipose tissue may initiate the inflammatory changes by a variety of mechanisms like adipocyte hypertrophy, microbial infiltration, production and secretion of pro-inflammatory molecules. These biotube, the pro-inflammatory molecules, initiates the signaling cascades which may result in endothelial dysfunction, oxidation of ADL, ROS, and initiates atherogenosis much before the appearance of clinical symptoms. Computed tomography allows quantification of the epicardial fat volume, but it is expensive, while by echocardiography, epicardial fat thickness can be evaluated, which is an easy and cost-effective. And the conclusion is that the current study concluded that visceral fat and epicardial fat both are increased in CAD patients, as we have seen in the results, as compared to control. It is suggested a possibility of excessive deposition of fat around the visceral organs and heart due to proximity of epicardial fat with the coronary artery, it can be considered as
Yeah, everything is fine. I'm not
a assault, which may initiate the
Okay.
atherogenosis. So these are the references, and thank you very much for listening patiently.
Thank you very much, sir.